Good morning, SEIU Healthcare Minnesota family. Thank you for joining our virtual convention this morning. There are so many things you could be doing today, and you chose to spend the day coming together with union leaders and members from across Minnesota, Western Wisconsin, and for the first time this year, Iowa, to strategize, organize, and decide on a program to make our union stronger in the year ahead. I want to begin by acknowledging the unique circumstances that lead us to gather together virtually again this year. It was our deepest and sincerest hope that we could join together in person to celebrate an emergence from a year and a half of COVID-19. And while I know that this summer we felt we were finally going to put this pandemic behind us, the virus is not done spreading yet. With the Delta variant and the increased cases in our facilities, our rank and file vice presidents took up the question of whether or not it would be prudent to convene a healthcare union convention in person, and they decided, in an abundance of caution, we should convene together virtually again this year. After hearing from home care workers who live in homes with immune-compromised family members, and from members who work in emergency rooms and ICUs with COVID patients every day, we want to make sure every member can participate and that no one would feel left out. So thank you for being here again. I want to thank our vice presidents and the staff who have worked so hard to plan the convention this year. Lynn Carlson, Latanya Hughes, Mary Bale, Corey Vandenberg, Kate Lynch, and Maxine Maxon, who just last month retired from her union leadership position and from a long and distinguished career as a nursing assistant at Fairview University Medical Center. Congratulations, Maxine. Staff members Tiffany Forrester, Luchelle Stevens, Ashley Christensen, and others have gone above and beyond again this year, from the creation of our logo to managing complicated registrations to drafting our rules and managing the technology for today. Thank you. I also have to thank my co-officers who are elected to work and lead our union on a full-time basis for their incredible leadership overseeing the union's bargaining and organizing programs this year. Thank you to Brenda Hilbrick, Rasha Ahmad Sharif, Philip Cryan, and a special thank you to Executive Vice President Jigme Ugin, who in addition to his other duties as an officer of our union, has spent many long nights and the weekends editing the videos for our convention today. They each do amazing work on behalf of our union every day, so thank you. As we begin and gather together today, I want to acknowledge and recognize and appreciate the hard work and sacrifices made by the members of our union this year. Working through a pandemic for 18 months is stressful. Wearing layers of PPE is exhausting. Members have sometimes gone a long time without seeing family members because their exposure to us, who are working day in and day out to fight this virus, could put their own health at risk. It's been a long 18 months. We all know that when soldiers go to war, their deployment usually only lasts for about a year. As a society, we acknowledge the hardship and toll that such heightened risk and mental exhaustion can take. It has been a long 18 months for our members who have been fighting the virus. And right now, everywhere I go, I see our members working short. Our membership numbers are down about 10% from 2019 as members have retired, moved, or left the industry. But the hours worked in healthcare have only increased, and hiring has not kept pace with our needs. Members are working doubles, working 20 days or more in a row. Employers are offering record bonuses to pick up extra shifts because of how short we are. Many are even offering signing bonuses, which is pretty rare in healthcare, to new workers, but only 3 hospitals offered any version of hero pay to those who stayed and who worked these 18 months. And in my opinion, that lack of hero pay is not only disrespectful, but it should be a crime. As workers who belong to the trade union movement, we know that regardless of our industry, that as workers under capitalism, we are not going to be paid 100% of what we are worth. If we were paid 100% of what we are worth, there would be no profit left over for the investors or ability to provide large bonuses to management. While employers celebrate their financial performance as a measure of organizational health, as workers, we see that profit margin also as a measure of our exploitation. In most industries, workers experience that feeling of exploitation in their bodies, whether in construction or mining or driving a delivery truck like my grandfather did. You can feel it. The long hours, the high rates of accident and injury. For healthcare workers, though, the feelings of exploitation can be even worse. We absolutely experience it in our bodies. Nursing home workers have the highest workplace injury rate of any occupation. When we go home, we hurt. but we are also being exploited emotionally. The short staffing, the low pay, the lack of PPE and supplies. Healthcare workers are too often being put in situations where we cannot provide for our patients, our residents, or our clients. We can't give them the care they deserve. We are capable of such incredible care, and yet these profit motives, compromised government policies, inefficient systems, ignorant supervisors all stand between us and the people who need our care. And I see it breaking so many members' hearts. I see people leaving healthcare more than ever because when they get home from work, they don't feel good about the care they were able to provide that day. The feeling of being exploited is palpable, and all over the state, no matter how bad we feel we have it, non-union workers are getting it even worse. The non-union sections of the healthcare industry, employers have imposed pay freezes, pay cuts, retirement plan cuts, and reduced paid time off for non-union workers from border to border. And they see SEIU Healthcare Minnesota members standing up, fighting, struggling, picketing, advocating for exactly what every healthcare worker truly deserves. They see as winning when they are losing, and more than any moment before, they are inspired and working to organize and join our union, to join our movement for better contracts, better standards, better staffing, and better patient care. Union care is the best care, and I am so proud of standing up and fighting back for our patients, for our families, and for our future as healthcare workers with all of you. Enough is enough. This year, our slogan across hospitals, clinics, nursing homes, and home care was, respect us, protect us, pay us. And we did win. We didn't win everything we deserve, but across all contracts, we made progress. And we did it by working together in solidarity. This past year, more than 5,000 members of our union voted to strike. 200 technical workers at Abbott Northwestern and at St. Francis Regional Medical Center did strike, and they won huge improvements to dependent healthcare coverage premiums, with members saving as much as $4,800 per year for family coverage. And they won paid quarantine time in the contract, so it wouldn't change and be taken away from them like Adelina did with the paid time off policy. A line of members under the master contract and at Regina voted for a week-long strike and won millions of dollars in wage increases, improved contract language, Martin Luther King Day as a holiday, and both our Alina and our Twin City Hospital members won new language on diversity, equity, and inclusion as our membership demographics grow more and more diverse. Members across both contracts won significant contribution increases to our pension, and we are so proud that those increased contributions will lead to improved benefits next year. As you know, Congress passed a new national holiday in Juneteenth this year, and I am so proud that our members at Open Cities Clinic in St. Paul became the first members in our union to win Juneteenth as a recognized holiday in our contracts. Home care workers negotiated their best contract yet with the state of Minnesota this year, and with the help of our political leaders from across all sectors, that new contract was approved by the legislature and signed into law by our governor. The new contract provides more than $100 million in raises as the minimum pay for home care workers goes up nearly 20% in the new contract from $13.25 an hour to $15.25 an hour. Nursing home workers across the state are bargaining our biggest increases in years, with members routinely seeing 5% to 10% increases this year, with the additional funding provided by the state. I mentioned earlier that only 3 hospital employers provided hero pay to their workers last year. Those 3 were Mayo Clinic, Rivers Edge, and Chippewa County. We applaud them for doing the right thing for workers who have worked so hard through COVID-19, but that was not good enough. Earlier this year, our executive board made our top legislative priority, along with the home care contract, passage of hero pay from the state legislature. President Biden, in his first act as president, was able to sign into law some one-time money to send to every state to help deal with the ongoing pandemic. We worked across party lines to submit a proposal to the legislature that would provide a minimum $1,000 hero pay bonus to all healthcare workers who worked through COVID-19. I am pleased to report that the legislature allocated $250 million for hero pay for essential workers and is just now finalizing the details of our hero pay proposal. We are confident that because of all of you and our union, that meaningful hero pay checks for healthcare workers will be approved and signed into law finally. If that was all that our union accomplished this year, that would be a great achievement. But that isn't all we've done together. Our fight has inspired non-union healthcare workers to stand up and organize with us for a better future as well. As we convene our convention today, more than 500 professional and technical workers at hospitals in the Twin Cities are voting to join our union in 4 separate union elections. There are worker committees in formation for hundreds more that we expect to follow them in the months ahead. I am also so pleased to report that we have joining with us today representatives from SEIU Local 199 in Iowa, where 5,000 nurses and professional workers at the University of Iowa and at Findlay Hospital are working to unite their strength with ours and help us build our capacity as a union of healthcare workers, with the largest professional and technical division in the Midwest. Both local executive boards are exploring a full merger, and our union hopes that we can call a special convention by the end of this year to confirm that merger with a vote of our membership. Despite all the challenges in front of us, a global pandemic, employers more focused on their profits than on their patients, a divided state legislature, we have built a powerful union that stuck together this year, that raised up that inspiring banner, respect us, protect us, pay us. And we have made advancements across all areas of our union, in hospitals, clinics, nursing homes, and home care. We are growing stronger every day. We have so much more work to do, but I am so proud of all that we have accomplished together in this most difficult year of our lives. I'm proud of you, and we will keep fighting to build a better world where instead of going home, feeling sore and tired and feeling like we've been emotionally exploited, we can feel invigorated and appreciated and proud of the work we did on behalf of the patients who needed our care. Thank you. I now call our convention to order.
Hello, everyone, and thank you, Jamie, for those opening remarks. So my name is Barb Steinerson. I am the president of SEIU Local 199 in Iowa City, Iowa. And I'm joining you today because we will soon be working with Healthcare Minnesota to try and develop our membership base here in Iowa City. I'm also a senior physical therapist at the hospital at the University of Iowa. As I'm sure you all know, that healthcare is under attack from all directions these days, especially with the pandemic. And we are looking to Healthcare Minnesota for some help in developing our base here in Iowa City. I'm really excited to be here today and hear more about Healthcare Minnesota and the programs that you've developed.